what's the danger zone and how do we avoid it? Let's talk about metacognition around knowledge in medicine and how that relates to risk. So there's something called the Rumsfeld matrix, which has two axes. Either you're aware or not aware of something. And on the other side is about knowledge. So either you know or you don't know something. And if you're not aware that you don't know a particular thing, then that is the danger zone. And in medicine, the idea might be that there could be some critical fact that is essential to know in order to safely manage a patient. But if you don't know it, that's very dangerous. And so the idea in medical training is to get as quickly as possible out of this danger zone into this developing zone, where now we're aware that we don't have some piece of knowledge, and that lets us act on it, either to ask for help or to look things up, and puts us in a much safer space, but still not quite where we'd want to be, where that knowledge is readily at our fingertips. If we know something but we're not aware of this, then I call this the autopilot zone. And this can still mean that you can provide the care that's necessary. You might have the skill or the knowledge required, but not having that awareness of the knowledge makes it so that you can't do as much with it. Finally, if we know something and we're aware of it, I would call this the expert zone. And being in this zone lets us make connections, handle complex cases, and be able to elaborate them in depth. And so, with any hope, throughout training, we're moving in these directions where we're increasingly getting into this quadrant of expertise. And I think as students are studying, it can be very helpful for them to engage in active strategies to increase their awareness of what they know and what they don't know.